Today we are going to discuss about different types of suffocation. What is suffocation? Suffocation is mechanical asphyxia which occurs due to the obstruction of passage of air into the lungs, excluding the constriction of neck and drowning. Smothering, mechanical occlusion of the nostrils and mouth. Smothering agent may be hand, pillow, or cloth. Homicidal smothering. Usually, the mouth and nose are closed by the hands or cloths, or the face may be pressed against the matrix, pillow, etc. Postmortem findings: circular pale area around the mouth and nose. As you are pressing against the pillow and matrix, there you see the blood circulation will not be there, so you will see pale area over the mouth and nose, and fingernail abrasions, contusions over the mouth, nose and chin will be seen. As the victim tries to uh, uh, defend, you will find this. And frothy bloody discharge from nostrils and mouth. Nose may be flattened due to the fracture of the nasal septum. Contusions and lacerations will be seen in the inner side of the lips. Tearing of the frenulum of the upper and lower lips. If a soft material like pillow is used, external injuries will be minimal or absent. There will be petechial hemorrhages, petechiae in the eyelids, and subconjunctival hemorrhage will be seen. Protrusion of the tongue will be seen. Suicidal smothering by using the homicidal bag over the head and face. Sometimes children will play with the polythene bag without knowing it will cause the suffocation. Okay, and accidental smothering is premature infants can be suffocated merely by the weight of bed cloths or by the breast when during the breastfeeding, covering the nose and mouth. So the mother's breast covering the nose and mouth. Children may get accidentally suffocated while playing with the plastic bags. A worker can fall and get buried into semi-solid or finely divided materials like ash, cotton, wool, flour, sand, mud, grains, etc. So this is all we'll see in the smothering. Petechial hemorrhages will be seen. Subconjunctival hemorrhages, petechiae in the eyelids, flattened nose due to the fracture of the nasal septum, bleeding from the nose, fingernail marks on the mouth, nostrils and chin, contusion of the lip, circumoral pallor. If you draw a diagram, it's good, better. Gagging is a method of asphyxial death when a small soft cloth or some other foreign object is thrust into the throat and obstructing the passages. Even a small cloth, um, if we are using for the asphyxial death, if they are using for the asphyxial death, then the small cloth will swell. It absorbs the saliva and it swells and it blocks the air entry. Chalking is a method of asphyxia which is caused due to the entry of foreign body into the air passage by causing the obstruction at the level of larynx or trachea. It is always accidental, commonly seen in the children who play with small objects like eraser, pencils, pen, caps, coins, buttons by putting in their mouth. Also seen in the alcoholic persons and elderly people due to the neurodegenerative disorder, suffering from the neurodegenerative disorders or due to the alcohol intoxication. Okay, so cave coronary, which is food asphyxia. This is due to the accidental entry of large bolus of food or meat into the air passage, obstructing the larynx. The cause of death is reflex vagal inhibition, which is resulting in the cardiac arrest. So, as the name indicates, cave coronary, something related to heart. So there is a inhibition of the vagus nerve, and you will see. Heart attack means cardiac arrest. In layman terms, it is heart attack and cardiac arrest, which is seen in the people who are under the influence of the alcohol. The suppression of the gag reflex occurs due to the gag reflex is caused by ninth nerve, that is loss of pharyngeal nerve. So this nerve action will be suppressed due to there will be suppression of gag reflex due to alcohol or drugs, which make the individual who is susceptible for the cave coronary. So it may happen in well-nourished person dying suddenly and unexpectedly in restaurants and caves, shortly after food or without any signs of respiratory distress. Death appears due to the heart attack. Hence the name is cave coronary, coined by Roger Haugen. First aid is Helmich maneuver. So Helmich maneuver is you should be going behind the intoxicated person or who are suffering with this. Then you should keep your hands at the level of the ribs level, okay, and you should hardly hit with your fist on the ribs, so that the fluid particle, due to that force you are giving, it may come out. So it is Helmholtz maneuver. Air atop At autopsy, a large piece of the food bolus is found obstructing the larynx. High level of the blood alcohol found in most cases. Traumatic asphyxia. Traumatic asphyxia is crush asphyxia or compression asphyxia or Olivier syndrome. It is due to the mechanical fixation of the chest, which prevents the respiratory movements, which is called as traumatic asphyxia. Circumstances due to the trauma, right? Trauma, or this is known as crushing asphyxia, due to crushing under the automobile, collapsed building, or landslide, and crowd stampede, steering wheel compression of chest in car accident, jackknife portion, victim's thigh and knees are brought against the chest, and restraint asphyxia, when the policeman restrains a forcible criminal forcibly by pinning him in the prone position on the floor with his hands backward and tied. What are the post-mortem appearances? Mask ecchymotica means when the person is in a prone position, you will see there is intense cyanosis and congestion of the, which is confined to the face, neck and shoulders above the level of the constriction. Hemorrhages which are not they are not petechial, they are hemorrhages which are seen in the conjunctiva. Petechial hemorrhages will be seen over the face, eyelids, neck and inside the mouth. Bleeding will be from the nostrils and the ears. Demarcation line is congestion above the line and parallel below the line of the compression. Fracture of the ribs will be seen. Lungs will be dark, heavy and show subpleural petechial hemorrhages. In steering wheel impact, transverse fracture of the sternum at the junction of the manubrium with the body, which is buccal sternum. Steering wheel impact means, you know some in Telugu films, some కార్ వెళ్తున్నప్పుడు సడన్గా అదేదో ఒక హిట్ అవుతుంది ట్రీకి, అట్లా అప్పుడు సడన్గా అతను ముందుకు పడిపోతాడు, ఆ డ్రైవర్ స్టీరింగ్ వీల్ మీద పడతాడు అనమాట. పడినప్పుడు హిస్ స్టర్నమ్ విల్ బీ గెటింగ్ ఫ్రాక్చర్, ట్రాన్స్ఫర్ ఫ్రాక్చర్ ఆఫ్ స్టర్నమ్ ఎట్ ద జంక్షన్ ఆఫ్ ద మ్యానుబ్రియం విత్ ద బాడీ, దాన్ని బకల్ స్టర్నమ్ అంటాం. ఓవర్లయింగ్ ఆర్ ఓవర్లేయింగ్ డ్యూరింగ్ ద స్లీప్, ఇఫ్ అడల్ట్ accidentally overlies over the infant, this is known as overlying. It is always accidental. Postmortem findings are intense asphyxial signs. Burking is a combination of both homicidal smothering along with the traumatic asphyxia. Assailant will be sit on the chest of the intoxicated person, close his mouth and nose by his hand. Seeing in so many movies this, and his companion pulls the leg and drags him on the floor. Environmental suffocation due to the lack of oxygen in the environment. During play, children may get locked in the large boxes or trunks. Okay, glue sniffing, inhalant abuse, cabin failure or aircraft at high altitudes. Thank you guys. This is for today. The types of suffocation we learned. Okay, bye guys.